Hi, and welcome to the healthcare edition of Outside the Box 2020. And I am back with Dr. John Rothwell. And Dr. John, how are you doing today?
I'm doing well. And I got to put that caveat out there. Dr. John, nurse practitioner.
I know. And you know, I don't know if you could tell or not, but when I said Dr. John Rothwell, and then my brain went, shoop, that's it, no more. I knew all of those things I needed to say. I just lost them. So thank you for adding that for me. So that actually kind of leads in pretty well to what we're going to talk about today. So tell me, one of the things that you told me the very first time that I visited you at your practice and became a member at your practice was the 5 pillars of healthcare. Tell me, recap those for me, because there's one we're going to talk about today.
Sure. So when I talk to you or any of my patients, I talk about what I call my 5 pillars of health or 5 pillars of wellness. So it's spiritual, physical, mental, emotional, and financial wellness. And if you don't have those balanced out, then there's usually something going on in your life that's a little uneven that could actually lead to what's traditionally called illness.
Yes, absolutely. So the reason that we started this healthcare Q&A is because of what we're dealing with right now in the world, which is the pandemic, the quarantine and the pandemic and all the craziness, which Dr. Ivan Meisner, who is the CEO of BNI, the networking group that I'm in, he calls it the Great Pause, which I kind of like. It really is. It's the great pause, like everything's stopped. And but there are some implications that go with that. We're still in the midst of it. We're about, I don't even know, like what day is it? What month is it? I don't know. What are we at, 4 or 5 weeks in that we've been restricted?
About 4 weeks in. I know that I've actively been testing for the COVID-19 or the SARS-CoV-2 virus for over a month now. So it's been a minute, and so I'm going to be a little bit open here to start this conversation. You know, at this point, you know, I've been locked up in my house. I go out about once a week, you know, to go to the grocery store and do that sort of thing. And not doing the greatest job at taking care of myself. I'm trying. I really am trying, but I'm not sleeping well. I'm not eating well. I'm not exercising enough. I try. You know, I dance around in the kitchen, and I do take a walk now and then, but I don't even really want to do that. I want to do it, but then I get out there and I feel weird, and yeah, I'm not sleeping at night. I lay in the bed and think about all kinds of crazy things, but then I still have to get up and I still have things to do. I'm scheduled all day, and some days I feel like I'm a little on the edge, and I'm hearing that from a lot of people. I want to read to you a meme that actually somebody just sent to me a few minutes ago, and I thought this is so timely. So here's the meme. My personality is basically a mix between a needy 5-year-old who cannot control her emotions, a teenage rebel who makes poor life decisions, and an 80-year-old who is tired and needs a nap. And that is exactly how I feel right now. So, and it's how a lot of people feel. Obviously my friend just sent that to me. You know, everybody, are you seeing that? I mean, what's your input on that? Is that normal? Am I crazy? Is it the new normal?
Is it the new normal?
You know, I have a patient panel of about 200 people. And compared to traditional primary care providers, they have between 2,500 and 4,000. And so I am personally involved in the lives of my patients, right? And so because we've made ourselves vulnerable to each other and we kind of know each other, I know how they're feeling and what's going on now. They're all healthy in retrospect, you know, as defined by, you know, they don't have a lot of chronic disorders and stuff like that. They don't take a lot of medications. There are a few of them that are getting healthier, but they all have one common thing, and that is
they're feeling tired, they're feeling emotionally drained. There's a feeling of uncertainty. And it's almost, it reminds me a lot of seasonal distress disorder, right? You know, when people live in winter climates where it's extremely dark and they get down and depressed because there's no sunlight.
That makes
And it
sense.
becomes unhealthy. And so right now, if you have this uncertainty or if you have risk factors, you don't want to go outside. You know, you don't want to go outside and get that sunlight and get that vitamin D that you need. Or if you're not an exerciser, and you're not used to a lot of activity more than going to and from work, to go outside and sit, that's not something that's of interest to you. And I think what we're going to find is really what we define as grieving. We're going to still see people grieving for their old life, right? They want that loss of what used to be, because our new normal may be different. I don't know. And to be honest with you, I'm a man of faith. So I'm not living in fear of what the new normal is. I'm actually quite excited about it, because what everyone's really having to look in the mirror right now and saying, okay, what are my risk factors? Because this pandemic is real. And do I have any risk factors that could make this my last illness, right?
Yes, yes. That, I mean, that's something that I think about. I don't think about that very often. But I'm glad you brought that up, because, you know, I am blessed. Let me start by saying that I'm blessed. I live in a beautiful environment. I have a beautiful balcony. I can go out and sit on the balcony. I have a great view, all of those things. And I sit out on the balcony pretty often and I think, this is ridiculous. I should just go and just do things. And then I think, well, but what if I caught that and it killed me? Like and it doesn't happen very often, but when I have those thoughts, it is distressing and it's upsetting, and I live alone. And that's a whole nother can of worms right there, because I don't see anyone. Fred back there, who's kind of judgy, and Flipper over here, who's happy all the time, but they don't talk much. You know, so yeah, it's deep. It's deep. I try to resist how deep it really is. And I'm okay most of the time, but sometimes I'm not so okay.
Well, and I think that gets into the meme that you just mentioned. I know you just said it. We didn't even talk about it in our little pre-discussion. That's the difference between being a teenager and a mature adult, is that while, you know, what the heck, let's go walk on the beach, let's go out there, I'm just tired of being home, to, okay, if I did that, what are the consequences? And
Yes.
and how, you know, what do the consequences mean to me? And so we really need to do that. So if we take that into ourselves, really look inside, what are the consequences that we're recognizing because of the kind of life we have been living? So while it's very true that there's some very healthy people without what we call comorbidities, or without, you know, predisposing conditions, that have actually died from complications of the COVID-19 virus. Many of the news outlets and persons and friends that you may know that work in the healthcare industry say there's people who have comorbidities that are at higher risk. And that's what the Department of Health and some of the testing locations say. If you're over the age of 65, if you have heart disease, kidney disease, lung disease, immunosuppressed, you're the person that we really need to look out for. But you still need to look out for everyone too, because it is affecting everyone else. But so when we look at that, look at the obesity epidemic that we have in our country, and how does that stem some of those other chronic conditions that we experience here in the United States. And I think if you bring all that together, you have a playground for something like the COVID-19 virus. And so I think people hopefully will look at a couple different things when this starts to slow down. And that is those 5 pillars. So spiritually, where do you sit spiritually? Do you believe in a power greater than yourself because this was scary? And what did you seek from there? Whether it's through meditation, through prayer, through reading scripture in groups who have like-minded individuals. For me, it's the Christian faith. To physical, what did you do physically to keep yourself conditioned to stay healthy in case you got sick? Did you exercise by doing push-ups and you know, jumping rope and doing things at home, riding your treadmill, or did you take the clothes off the rowing machine and actually use the rowing machine? That's a shout to my wife.
Yeah.
Get me good on that one. You know, mentally and emotionally, what are you doing to keep mentally and emotionally fit? Are you having Zoom calls like we're having now with family members and friends, just so that you can have that face-to-face interaction versus what we used to have growing up was a telephone? And because we do so much texting now, and that can lack personalization. A lot of my younger patients actually love to text, but my older patients, they want to talk and have face-to-face meetings. And then of course the financial ramifications of this are going to be catastrophic, just like the potential health implications.
Yeah. Those are all great things. So a couple of things that came to mind while you were talking. One, I would absolutely love, excuse me, I would love for us to do a session on each one of those pillars, because I think there's a great discussion in each one of them. You know, as you were talking, I thought, oh goodness, we could talk about this. And I thought, no, let me not say anything. Oh goodness, we could talk about that. No, let me not say anything. So let's plan to do that. Let's plan to really focus on each one of those pillars and have a discussion just dedicated solely to it.
Right.
And then, as you know, I do a lot of training, and I've been doing a lot of connecting with people via Zoom. I do training and consulting. I'm a PR specialist, and I've always had the capability to hold conferences and consultations and training in like this via Zoom or other platforms. But previously, nobody had really shown much interest in doing it. You do telemedicine, which I love the platform that you use. We had a telemedicine call on my cell phone, and I was looking right at you, and that's amazing. And you know, we've had that technology, but we haven't really used it. And now people are more acclimated to it, and they're actually using it. I've got 4 other calls scheduled today. I had 7 yesterday. So anyway, that being said, training, one of the things I always try to do in my training is at the end, I try to give 3 major points to kind of wrap up a conclusion of what I talked about. And this, we want to kind of keep this brief, but will you give us, say, 3 suggestions or 2, whatever works for you, on things that we can do right now to kind of manage our emotional levels? Because I think everybody, whether they admit it or not, they're transparent. I'll admit it, I'll be transparent. I am all over the place. One minute I'm up, next minute I'm down. So I have a lot of conflicting feelings. What are 3 things that we could do to work on that, to kind of keep ourselves even and level while we wait on things to return or get to a new normal?
Sure. So when I work with my patients, and I talked about the 5 pillars of wellness, I take a 4-tiered approach.
Okay.
So that 4-tiered approach is lifestyle changes. So for me to be completely vulnerable, what I had to do was start my day off with my spiritual fitness, to get my mind in the right place to serve others, because that's what I do. So that is the lifestyle change. So whatever order your 5 pillars are in, you prioritize those. So right now for me is, my spiritual fitness, first thing in the mornings, 1 hour. That's what I do, no matter what. Then the next thing.
Okay, let me stop you for just a second. So for 1 hour in the morning, you focus on your spiritual fitness, in the interest of inclusion. And we talked earlier about, everybody's spirituality that's a very unique and individualized subject. So everyone's a bit different. And, for some people, they may immediately say, yeah, okay, whatever. So that could be meditation or reading your Bible or whatever. That could be any number of things. What are some things that you might recommend for that? My immediate thought was meditation. I don't know that I could dedicate an hour to it, to be honest.
You can't. Okay. And so for me, again, I was using my example.
No, I like it.
But when I talk to my patients, I actually said, I ask them what their spiritual beliefs are. So I have an idea. So for meditation, if you're not used to meditating and you might not even know what your spiritual belief is, we kind of start with training of just a few minutes of kind of getting out of yourself and into a place that brings you peace. And so in some environments, like yoga and stuff like that, we start with breathing, right? And so there's a specific kind of breathing that, I can teach you to where you're focusing on your breathing, your inhalation and exhalation, to clear your mind, to get in oxygen, to push out outside noise, which is difficult for people like you and me.
Yeah.
And so that could be a form of meditation, and it just may be a couple minutes. It may be 5 minutes. It may be longer, and it takes training, just like what I was going to get into next, which was the physical aspect of it. So there's spiritual and physical health kind of go hand in hand, and it almost starts with the food that you put in your body. So when I was talking about those 4 tiers, right? So lifestyle change for me is I got to focus on getting my wellness in right priority. So for me it was spiritual, and then physical, right? Then it's food's the best medicine. And so your body's going to respond based off of what you put in. So whether you're putting in good spiritual stuff, whether you're putting in good food stuff, your body's going to respond to that. So if you're putting in stuff that causes inflammation, then you're going to be inflamed. You're not going to feel good. You're going to feel bloated. You're going to feel sluggish. You're going to have brain fog. If you're bringing in sugar, you're going to have the highs and lows, right? So we tend to emotionally eat in times of stress like this, because we have this, with stress, you have an increased level of cortisol, which means oftentimes you have difficulty regulating your sugar. And and you're eating all this sugar, and then all of a sudden, bam, you crash, and then you're exhausted, and then you're tired, and then you're depressed. So you really kind of have to balance these things out. So I have a very strict isn't the right word. I have a very consistent routine. They might happen at different times of the day, but they happen throughout the day. They need to, because if they don't, then I'm unhealthy. And so for me, my day has to start spiritually. For someone else, they might have to start without working out, just to get the muscles moving so the brain starts moving. And some people need that in the middle of the day. They need it at their lunchtime, so they have that 3 o'clock crash. So everybody's individualized. So when we work together and we get past the acute medicine phase and the illness phase, and we get to know each other, we actually then says, okay, well, what's important to you, and how do we help each other on that journey to get to that optimum level of health? So for me, I focus on, lifestyle changes, food's the best medicine, then supplementation, those vitamins and minerals that you may be deficient in, and then pharmacology if needed. So
yeah. I love it so much, those 3 pieces that you mentioned, because when we didn't prep for this, really, we just talked about, what we were going to talk about in general. And, when I started the conversation, I said, my diet is all over the place. I'm not sleeping properly. I'm not exercising properly. And what you said, your 3 points, you hit all 3 of those. And I know it. you know, I mean, I know I'm educated enough to know, and I had already identified that that was contributing to my mood swings, if you will. Whether I'm hiding them from everyone else or not, I'm feeling them. And I know it's because I'm not sleeping properly and I'm not feeding myself properly. And I do supplement, you know, I have all the parts and pieces, and I know what I should be doing, but it was good to hear you say those things, because it kind of drives the point home and reminds me. And I'll do a little better job. Maybe the next time we talk, I'll give you an update on whether I actually implemented it or not, because I know
We call that accountability, right?
That's
and
right.
So I can't own your care. I can't own anybody's care.
That's
right. But what I can do is be a gentle consult who has the education and background to help guide you to a higher level of care, and at the same time help you hold yourself accountable for your own wellness, right? Because at the end of the day, I can come up with all the cool plans in the world. I got the background, but you're the one who has to do the work. You're the one who has to do the action. So that's what I love so much about personalized primary care, right? Or
me too.
Me too. And the time to do that. I'm not a psychiatrist. I'm not a psychologist. I'm not a medical doctor or doctor of osteopathic medicine. I'm an advanced practice registered nurse. I have traditionally been trained in caring and then trained in medicine. So I like that holistic concept of basically integrating the best of the best, but more importantly, personalizing it for my patients.
Well, I appreciate what you do very much. As you well know, I'm your #1 fan. And if I'm not your #1 fan, don't tell me, because my feelings will be hurt. I'm your #1 fan. So for people who have not listened to us before or not familiar with you, I would like to take just a second here at the wrap up of our conversation to let people know who you are and where you are and what you do, because I believe there's a huge population out there that needs your services, you specifically, because I think you're wonderful, but not too many, because I need you. So tell everyone who you are, where you are, and what you do.
So I'm John Rothwell. I have a doctor of nursing practice, so I'm an advanced practice registered nurse. My board certification's family practice, so I see all ages. My youngest patient was 5 days old. My oldest patient is 84. And Island Direct Primary Care is a direct primary care practice that takes a free market approach to healthcare. So it's a healthcare alternative. It is not health insurance, but it's a monthly membership that provides you 24/7 access, same day, next day appointments, and cost transparency that is driven personally for you, the individual, or for employers. So we actually have employer packages so that small businesses can actually offer a healthcare alternative for their employees that's cost effective.
And I love that. I love that so much. I think that we need to really educate employers about that. I talked to somebody the other day about it and said, you know, you really should talk to your employers, a small mom and pop organization. And, you know, and it's difficult. Everybody's just trying to make ends meet, and it's definitely an affordable approach. And I wouldn't take $1 million for you. I appreciate you so much. And so it was always fun to talk to you.
Thanks very much. Hopefully my website's getting updated now. It's www.islanddirectprimarycare.com. Okay.
And that should be listed right there underneath your picture, so people
Awesome. Well, thank you so much, Janice, for having me. It's been a pleasure. And we'll talk offline about some of the things that you're going through, see if we can't keep those wheels on the track, so to speak.
Yeah, I'm working on it.
Doing awesome.
I appreciate your help. Thank you so much. I'll see you again next time. Until then, take care of yourself.
Sounds good. Take care, Janice.
Mm-hmm.